Fungal culture. Detailed explanation. Mod 1 Introduction. Fungi are a diverse group of organisms that include yeasts, molds, and dimorphic species. Unlike bacteria, many fungi grow slowly and require specific conditions for growth. Fungal infections can range from superficial, skin, hair, nails, to deep systemic mycoses, affecting the lungs, bloodstream, brain, and other organs. Because clinical symptoms of fungal infections often mimic bacterial or viral infections, laboratory diagnosis through fungal culture is vital. It is considered the gold standard for the identification of fungal pathogens. Definition. Fungal culture is a laboratory diagnostic test where a patient's clinical specimen is inoculated onto special media that favor fungal growth, e.g., Sabarod's dextrose agar. The test allows fungi, yeasts, molds, dermatophytes, dimorphic fungi to grow under controlled conditions, which are then identified by their colony morphology, microscopic features, and biochemical tests. 3. Indications. Doctors order fungal culture when they suspect fungal infection. Some situations include persistent respiratory infection not responding to antibiotics, possible aspergillosis, histoplasmosis, or blastomycosis, oral or vaginal thrush, suspected candida infection, chronic skin lesions or scaling suggestive of dermatophytes, ringworm, tinea, nail discoloration and thickening due to onychomycosis, central nervous system symptoms in HIV patients, possible Cryptococcus neoformans, fever of unknown origin in immunocompromised individuals, suspected fungemia, fungus in blood in patients on long-term IV therapy, chemotherapy, or organ transplant. 4. Used for detection to confirm presence of fungi in clinical samples, identification to determine the exact species causing infection, drug sensitivity. Some labs perform antifungal susceptibility testing on cultured isolates. Epidemiology and outbreak investigation, identifying rare fungi in hospitals or communities. 5. Why do need of this test? Fungal infections are increasing globally due to widespread use of antibiotics, corticosteroids, chemotherapy, organ transplants, and HIV/AIDS. Symptoms overlap with bacterial infections. Misdiagnosis can delay treatment. Some fungi are resistant to standard antifungal drugs. Proper identification is essential. Early culture can prevent life-threatening systemic infections. 6. What happens during the test? 1. Specimen collection depends on suspected infection site, blood, fungemia, sputum, bronchoalveolar lavage, respiratory infection, CSF, meningitis, skin scrapings, nail clippings, hair, dermatophytes, tissue biopsy, systemic infection, urine, vaginal swab, wound swab, localized infections. 2. Transport and processing. Specimen transported quickly under sterile conditions. 3. Inoculation. Sample inoculated onto fungal culture media. Sabarod's dextrose agar, SDA, potato dextrose agar, brain heart infusion agar, chromogenic media for candida differentiation. 4. Incubation. At 25 to 30 degrees Celsius, molds grow better at lower temperature. At 37 degrees Celsius, pathogenic yeasts, dimorphic fungi. Duration, few days to several weeks. 5. Examination. Colonies are examined for macroscopic features, color, texture, growth rate, microscopic features, hyphae, spores, conidia, biochemical serological tests, e.g. germ tube test for Candida albicans. 7. How long for my results? Candida spp yeast, 2 to 3 days. Dermatophyte skin nail fungi, 1 to 3 weeks. Dimorphic fungi, histoplasma blastomyces, 3 to 6 weeks. Aspergillus cryptococcus, 3 to 7 days for initial growth. Final report can take up to 4 to 6 weeks depending on organism. 8. Prepare for this test. General. No special preparation for blood, urine, or tissue samples. Respiratory specimens. Early morning deep cough sample preferred. Skin nails. Do not apply creams, ointments, or antifungal powders before collection. Medication history. Inform doctor if taking antifungals or corticosteroids as they may suppress growth. 9. Risks to. Minimal risks in most cases. Mild pain, bruising, or infection at blood draw or biopsy site. Minor skin irritation during scraping. Psychological discomfort due to invasive sampling, lumbar puncture for CSF, biopsy. Matter 10. Normal values. Negative fungal culture equals no fungi isolated, indicates absence of pathogenic fungal infection. However, negative result does not always rule out infection. Slow-growing fungi, prior antifungal use, poor sample. 11. Interpretation results positive, fungi isolated and identified. Example, Candida albicans, oral, vaginal thrush, Aspergillus fumigatus, pulmonary aspergillosis. Cryptococcus neoformans, cryptococcal meningitis, trichophyton rubrum, ringworm, nail infection. Negative, no fungal growth detected. If clinical suspicion remains high, repeat test or combine with molecular methods, PCR, antigen detection. 12. Factors affecting results. False negatives, prior antifungal therapy, inadequate specimen, small nail clipping, superficial scraping only, improper transport storage, false positives, environmental contamination, overgrowth of bacteria not controlled with antibacterial agents and media. NADR 13. Clinical significance. Guides targeted therapy instead of empirical antifungal treatment. Prevents resistance. Some fungi show natural resistance, e.g., Candida krusei resistant to fluconazole. Differentiates colonization from infection, especially in respiratory and urinary samples. Critical for immunocompromised patients, life-saving diagnosis and transplant HIV, AIDS, or chemotherapy patients. 14. No more. Fungal culture versus direct microscopy. Culture is more sensitive but slower. Newer alternatives. PCR, antigen detection, galactomannan beta-D-glucan, MALDI-TOF MS for rapid identification. Safety. Some fungi are biohazardous, e.g., Coccidioides immitis, and must be handled in biosafety level 3 labs. 15. Conclusion. Fungal culture remains the gold standard diagnostic test for detecting and identifying fungi, despite being time-consuming. It provides invaluable information for clinicians to select appropriate antifungal therapy and manage patients effectively. While newer molecular tests are faster, culture allows species-level identification and susceptibility testing, making it an essential component of mycology and clinical microbiology. Thank you. Have a nice day.